Due to globalization, we see a lot of fertility cases increasing. Maybe due to stress, or unhealthy eating habits, as well as lack of exercise are the most common reasons. Mostly men and women are affected in the equal state. And if you see that most of them, 6 in 1 families have the fertility problem. So nowadays when we see the pattern of the disease, we shift of the disease from the fertility infectious disease has gone into a fertility hormonal disturbances. The most common problem we encounter in girls is polycystic ovarian disease, in which there is a problem with ovulation. This is the formation of an egg, mostly due to the hormonal imbalance. Just reduction in weight and healthy eating habits and slight correction of the hormonal variation can actually correct this problem. And when these healthy habits as well as exercise actually correct the problem, they are able to conceive easily. In those people who cannot conceive by these methods, we do an ultrasound monitoring as well as medical treatment. In spite of all these things, if still the patient is not able to get pregnant, then we go for a higher treatment called in vitro fertilization or intracytoplasmic sperm injection, where the eggs are actually taken out and fertilized with the sperms and put back into the uterus as embryos. In men, we encounter a lot of problems for a person with a normal count as well as with a person with a low count. In patients with a normal count, we see that the motility is not good or the fertilization potential of the sperms is not very good. So correction of these fertility potential, which is diagnosed by the DNA fragmentation test, actually the first of its kind done in Chennai, we are able to correct the fertility potential of the men by giving him simple advice of healthy habits as well as antioxidants, making the sperms come into the healthier or the higher fertility potential. The sperms which have a higher fertility potential are able to give a good pregnancy rates by forming good embryos or even with natural intercourse or a simple treatment called intrauterine insemination. Here in Pearl Singapore Fertility Center, we have all the treatments starting from counseling, medical treatment, ultrasound treatment, IVF treatment, and in patients who have excess embryos, we have even the cryopreservation of the embryos as well as sperms. I wish all the people who comes to our center to have a happy parenthood at the earliest. Thank you.